HQI, Tracking Sepsis in Virginia Hospitals and Nursing Homes conference call. My name is Victoria, and I will be your operator for today's call. At this time, all participants are in a listen-only mode, and later we will conduct a question-and-answer session. Please note that this conference is being recorded, and I will now turn the call over to Lisa Mark. Lisa, you may begin.
Thank you so much. Good morning, and thank you for joining HQI and Tracking Sepsis in Virginia Hospitals and Nursing Homes. My name is Lisa Mark, and I'll be your guide today. I'm hosting this webinar on behalf of Deb Smith, the HQI Improvement Consultant and Sepsis Project Lead in Virginia. I'd like to remind you that the lines will be muted until the question and answer time, but the chat option is available. This webinar is being recorded. For the next hour, I will provide an overview of the Sepsis Project. You'll view an award-winning video demonstrating how to use the Sepsis Toolkit, and then we'll go over each one in detail. We'll also review some popular Interact tools, talk about Box, and conclude with project updates and needs. Before we get started, I'd love to introduce you to the smiling faces of your team at HQI and VHHA. With HQI, we have Deb Smith, Improvement Consultant and the lead for the Virginia Sepsis Project, Candy Hamner, Improvement Consultant and lead for the Maryland Sepsis Project, and I'm Lisa Mark, Improvement Consultant. And with VHHA, we have Betsy Cole-Archer, Director of Performance Improvement, and Wanda Clevenger, Director of Performance Improvement. Let's start off today by reviewing the current call schedule. On the fourth Tuesday of each month from 11 till noon is the nursing home call. Quarterly and then taking place of the monthly call is a combined nursing home and hospital call, and we'll schedule regional calls and face-to-face events as determined and needed. Most of you were signed up and onboarded prior to this webinar, but for those who joined just a little late and to review for those who have been with us all along, let's look at the timeline of where we've been and where we are currently. Later in the webinar, I'll go further with the current timeline and data needs. December 2016 is when recruitment ended, and then in January 2017, we started with the self-reported data. In January, we had our kickoff webinar, and in February, another webinar for the baseline data. In February, we mailed a Seeing Sepsis 100 Toolkit to you, and then that brings us to March with our resource webinar and onboarding wrap-up. One of the benefits of joining HQI is your access to our toolkit. It contains resources to help with staff education. We introduced these on the past webinar, and we emailed them out last month in a yellow envelope. Please contact Rhonda Fletcher or Deb Smith if you are in need of this email or you cannot find it in your inbox. When the toolbox is complete, we'll go ahead and send you with a thumb drive. The toolkit that we mailed contained a get-started quantity of 25 each of the Seeing Sepsis pocket cards and the HQI family and resident brochure, and 5 each of the Seeing Sepsis Algorithm and early detection flyer. The Seeing Sepsis program was prepared by the Minnesota Hospital Association. The first tool is a sheet of pocket cards, and this serves as a quick reminder of the clinical indicators and warning signs of sepsis, which is pulse greater than 100, systolic blood pressure less than 100, and temp greater than 100, and also a change in usual condition of the resident. Please feel free to copy, cut, and laminate these cards so that the residents or so that the staff can carry them with them, but better yet, have them clip them to their ID badges so they're with them at all times. The second resource is the early detection flyer called Act Fast. Early detection of sepsis requires fast action. We'd like you to post this in the med rooms, the break areas, the med carts, or anywhere with great visibility. For every hour that a resident is in septic shock and doesn't receive antibiotics, the risk of death increases by almost 8%, highlighting the need for planning ahead to decrease mortality rates. Much like you would plan for a fire by performing fire drills, it's important to train staff with a methodical planning tool such as the one here. Some questions to ask yourself as you get started on the project may be, are advanced directives and most forms readily available to staff? The labs are we able to draw quickly? Have we pulled in our lab, medical, pharmacy services to make sure we have consistent and timely availability of equipment for lab draws, IV starts, catheter starts. Does our on-site availability of antibiotics match our prescriber preferences, and do our care levels match the prescribing needs? Our physician numbers and on-call schedules post it readily. The third resource is a Sepsis Algorithm. Just what is an algorithm? It's simply a set of instructions that enables you to perform a specific function or a model for making decisions. Since we do know that sepsis is a condition that results in rapid deterioration, having your staff act quickly and methodically is essential. This resource follows the continuum of care from the assessment of signs and symptoms to the resulting treatment. The fourth and final resource of the toolkit is the Resident and Family Education Brochure entitled The Resident and Family Guide to Understanding Sepsis. This was developed by HQI and our valued family patient advisors. Written in layman terms, it helps family members quickly identify sepsis, and it's a great outreach tool. To see our toolkit in action, we're ready to view the video. Late in February, these HQI stars, pictured here, filmed a video at Autumn Care Botanicville. From left to right is Rhonda Fletcher, a project assistant, who played the role of the patient. Katie Richards, an improvement consultant working with Maryland providers in the role of the CNA. Darcy, an HQI patient and family advisor who played Mary's concerned friend. And finally, Deb played the role of the RN. Amy will be ready for the video.
She's been watching since that day here with about 30 minutes. I was having her favorite soda, and she has not eaten not one of them. Mrs. Jones, do you know where you are? I think I'm at reading still. But it's hot and tired today. Well, she's reading this book that was included in her admission package. And I was just wondering if she could possibly have sepsis. Okay, Mrs. Jones, let me try to make you a little bit more comfortable. I'm going to check in with your nurse, see what we can do to help you feel better. I will check your vital signs, and I will ask about the possibility of sepsis. Yes, I just checked her name vital for Mrs. Jones. And she has a terrible vital load. Her pulse rate is 120, and her blood pressure is 90 over 40. Her friend said that she was feeling hot, tired, and she had no appetite, even for her favorite donuts. She was a little bit confused when I first entered the room, but then she did know where she was. I checked the pocket card that I got from HQI, and there's a little too many developing signs and symptoms of sepsis. You know, if you look at this back poster, she does have those implied symptoms for sepsis. I'm going to go take a look at her, and then we'll call the doctor. Mrs. Jones, I'm also concerned that you may be developing sepsis. Your increased temperature, increased heart rate, and your decreased blood pressure, they're all just not a normal way of fighting infection, but it can also be pointed to sepsis. So I looked at your advanced directive, and you're okay with treatment according to your advanced directives, and you're also okay with being transferred to the hospital. Your daughter is your point of contact, so we're going to be calling her and letting her know. Do you have any questions for me? The child that they be able to do something to help that? Yes, very quickly. She stayed in Congo? Absolutely. I will be working by inside. Don't worry about it. How still do you all know? We are going to talk about it immediately and we'll be right back. Dr. Mitchell, I'm glad to pick up so quickly. This is Beth, the RN at Raven Health, and today I'm taking care of your patient, Mrs. Jones. She's not doing well today, and I'm concerned that she may be exhibiting signs and symptoms of sepsis. We noticed at the start of the shift that she just wasn't herself, and I'm very concerned that she has no appetite and is very tired. She's sterile with a temp of 101, her heart rate is 120, and her blood pressure is 90/40. She does have a cough, and I'm hearing some cracks and rails when I listen to her lungs. Her O2 tests are 89%. We have the ability to start an IV here. Would you like to give me some orders? Thank you, Dr. Mitchell. Let me just read those back to you. We'll be calling for transport and sending her to Hillside Hospital. Since we have the ability to start the IV, we'll be starting it with 0.9 normal saline and running it at 30 mL per day. Thank you. Bye. Mrs. Jones, it's so good to see you again. You're looking so happy and healthy. How are you feeling today?
Much, my friend's coming. She's bringing my favorite donut.
Oh, it really is good. How are you? Good. How did you do today?
So much better. Wonderful.
Thanks so much to Autumn Care of Mechanicsville for providing our filming site. In keeping with the spirit of sharing best practices, we've listed some post-video questions. If you've had the chance to use any part of our toolkit, we would love to hear your feedback. If you could please comment in chat, or when the lines open at the end of the webinar, if you could provide your feedback on the tools, we would love to hear from you. Now we'll continue with some additional resources. Many of you are probably already familiar with the popular Interact tools or a variation of them. Interact stands for Interventions to Reduce Acute Care Transfers, and it's a quality improvement program that focuses on the management of acute changes in our resident conditions. This online resource contains communication tools, care paths, advanced care planning tools, and QI tools to help with the goal to improve in care and long-term care. It was initially developed by the Georgia Medical Care Foundation with a contract from CMS. A very popular tool within the Interact program is the Stop and Watch. These forms are completed by the staff anytime they note a change in condition of the resident. Facilities who use this form report a very high success rate. So here are some strategies that we've outlined from your peers. Include all departments, such as nursing, dietary, housekeeping, and therapy in your rollout. Perhaps start with one unit and evaluate before a facility-wide rollout. Reproduce the paper onto brightly colored paper and place it in readily accessible locations, such as nursing stations, charting areas, etc. Establish a location to place completed forms, such as a folder or handoff to the charge nurse directly. Establish a frequency for review of the forms to identify patterns and conditions. And monitor the number of forms removed from the location versus the number of forms completed to evaluate follow-through. And again, if any of you have used this Stop and Watch and you'd like to upload comments into chat, we'd love to hear from you. One additional Interact tool is an assessment tool called SBAR. It stands for Situation, Background, Assessment, Appearance, Review, and Notify. There are a number of different SBAR tools, and you can customize this as many facilities do. The website for all the Interact tools is provided there at the bottom of the form. So to recap how all of these Interact tools can work together, a nursing assistant completes the Stop and Watch form and submits to the charge nurse. The charge nurse initiates the SBAR, assesses the resident, and communicates this information to the physician. The physician orders are given for labs and urinalysis. And the diagnosis, severe UTI, treated within the facility and avoiding a transfer to the ER in a possible sepsis case. The next slide has an example of an SBAR tool that was shared by Shady Medical Center in Maryland with their peers during the Maryland Stopping Sepsis Project. And we do encourage you to please share best practices and tips with your colleagues throughout the project. And speaking of sharing best practices, tips, and resources, if you've not yet joined Nursing Home Improvement Network through HQI, please sign up today with the link provided. I promise you it will take you less than 2 minutes to sign up, and we don't require any data up front. Our current participants are enjoying assistance with improving their long-stay quality measures through webinars, MDS coding tip sheets, implementation checklists, and the Copy Toolkit. And as well, each month our data analysts prepare a report with detailed graphics with validated and predictive composite scores of each long-stay quality measure. It really does allow you to quickly target the areas needed for improvement. And I promise again, it's a quick sign up and there's no data submission required on your part. Now let's take a look at the most recent additions to the timeline and the action items that are needed now by all participants. Deb sent an email on or about the 21st detailing this information. If you cannot locate the email, please reach out to Deb Smith. Her contact information will be available at the end of the webinar. We ask that you complete these onboarding tasks before 3/31, as you won't be able to move on with the project without doing that. And so we'd like you to sign up for your Box account, and I'll go into more detail about Box in just a moment. We need you to review your baseline data reports, complete a baseline prevention assessment, and then upload your data, beginning with data from January 2017. So what is this Box term that we keep referring to? Box.com is a secure file transfer protocol system for sharing data, and it's widely used by the banking industry. This is the only means by which we'll transmit sensitive data, so it's very important that you sign up today if you haven't already. How do you get started with Box? First, accept the emailed invite from Linda Harris, and please act immediately as it does expire within 7 days. Linda will send out reminders every 2 weeks for participants not yet signed up, and detailed instructions were sent either by Deb or Wanda in the email. Listed on your screen is the monthly data that we will require you to upload into Box via the template. I'll give you a brief moment to review these now. The next screen simply shows a screenshot of the template that you will use within Box. And this is just simply a screenshot of the instructions, the upload instructions that were emailed by Deb. The last required item that we'll need from you is a completed baseline infection prevention assessment. And so this is so that we can develop an education plan for identified gaps and barriers in the cohort's infection prevention programs. And finally, just as the HQI has a team working together to make this project a success, we're asking you to do the same in your facilities. Really think about who should be on your team to assure continuity and sustainment to the project. And then we do request that you submit a copy of your team contact via the link. So hooray, a cheer, because you are actually now ready to track your progress. Because these tasks complete the onboarding process, and we're ready to drop the updated data report through third quarter 2016 to your Box folders next week. For the last part of the program, we just wanted to assure you that HQI will be with you each step along the way. Our team of experts does stand by to assist you with any questions. If you have problems with Box, please reach out to Sarah Helen Studebaker. For hospital data and report questions, Wanda Clevenger, and for nursing home data report questions, Deb Smith. And just a reminder that Deb Smith is your point of contact throughout the entire project. Please save the date for our next webinar, April 25th from 11 till 12 noon. This concludes the presentation of the webinar. The HQI team is cheering for your success, and we are confident that you will successfully reach the goal of increasing awareness and reducing sepsis mortality rates. Thank you so much for your time.
Hi, this is Candy Hamner. We'd like to have the evaluation put up now. And we'd like to open the lines for any questions.
If you would like to ask a question, please press star then 1 on your touch-tone phone. And I'm showing no audio questions at this time.
And there are no questions in chat. If anyone wants to put a question in chat, please do so. Guess that's the last call for questions. Okay, well, we thank you all for participating, and if you do get a question, feel free to email Deb any question you may have after you hang up this phone and disconnect from the webinar, and we appreciate all of you for attending, and have a good rest of the day. The next webinar is, we just had a chat. The next webinar is can we go back, the slide here. Can I get the ball? Okay, it's April 25th, 11 noon. And this one, I believe, Wanda, I think you're on the phone as well. This is a joint one with hospitals and nursing homes, correct?
That's correct.
Okay, so this will be a collaborative call. Any other questions in chat or on the line? Anything you want to add, Wanda, about the April 25th webinar?
No, one thing I can add is that if people check their box folders, I believe that Jennifer has placed the reports for the third quarter of 2016 in the folders.
Oh, so they're in there now. That's great. So, please check your box folders, and if you have any questions, again, get in touch with either Sarah Helen, which was on one of these slides, or Deb.
And one addition, at the presentation on the 25th, Jennifer will be discussing those reports.
Great. She's a great asset. She can answer all kinds of questions about the data, so that's really great. She'll be on the call. Lisa, is there anything else you want to add? Teresa, anyone?
No.
Okay. Oh, wait a minute. Someone has another question here. The toolkit. Can you tell us, could you put in chat, Carla, what facility you're from, and we'll get your toolkit to you. Okay. Okay. Laurel from Charlottesville. Okay. We will get a toolkit to you. We'll find out where yours went. Okay. Thank you, everyone. The slides for today are in the box folder. Are they in the box folder? That I don't know the answer to as to whether the slides for today are in box or if they can be accessed.
Candy, the slides for today were emailed to all of you in the last calendar invite you received from Deb Smith. But if you need them, you can email any of us, and we'll be happy to send you the slides individually as well.
Thank you, Teresa. Thank you, Teresa. Okay. Autumn Care of Portsmouth also needs a toolkit. Okay. Anyone else? Okay, thank you very much for attending today, and we will see you next month.
Thank you, ladies and gentlemen. This concludes today's call. Thank you for participating. You may now disconnect.